Low energy, brain fog, low libido, it might be low testosterone, and it's more common than you think. Hi, I'm Dr. Brar, board certified family medicine physician and certified menopause provider. We consider testosterone replacement when patients have symptoms and confirmed low levels. Symptoms like fatigue, muscle loss, low libido, or mood changes. Benefits can include improved energy, strength, lean muscle mass, focus, libido, and overall sense of well-being. But it's not one size fits all. Risks can include acne, voice deepening, hair changes, and increased red blood cells. So monitoring is key. I personally would want to check levels prior to starting and then monitor closely so you're in a range where you're getting the benefits, but the levels aren't getting so high that you might have unwanted side effects. Testosterone replacement comes in a few forms. There is no FDA-approved formulation for women, so the use is off-label and oftentimes it's compounded. So first we have injections. They're consistent, they're mostly producing predictable levels, and they're usually cost-effective. But you may feel peaks and dips depending on how often you're dosing. Next, we have topical creams or gels, which are my personal favorite. They're applied daily, they give more steady levels day to day, and you avoid needles. But absorption can vary, and they can transfer to partners or kids if you're not careful. You can get this compounded for easy dosing, but if you're using a men's product, then you would want about 1/10 the dose a man takes. Next, we have pellets. They're long-lasting, they're placed every 3 to 4 months under the skin. I don't love this method of delivery because once you put in a pellet, you can't take it out. So we can't really do anything about side effects that you might experience. If you're seeing a provider or a clinic who only does pellets, you need to ask why your care is not individualized and why you don't have options, and just make sure that there's not a financial incentive there. We choose based on your lifestyle, your goals, and how your body absorbs hormones. That's why we take a personalized physician-guided approach. So go talk to your provider about if you would benefit from testosterone.